CIMA's November 2018 strategic case study centres on the fictional company of Novak Pharmaceuticals. And over the course of these videos, I'll be walking you through each section of the pre-scene document, commenting on the implications of the information contained in each section, relating it to some of the key theories you have come across already during your E3, F3 and P3 studies, and talking about potential exam issues. So starting with this introductory section to Novak Pharmaceuticals, you're told that you're a senior manager at the company in the finance function, and you report directly to the board, advising on special projects and strategic matters. We're then told that Novak is based in the fictional country of Kronland and that their currency is the C dollar. Novak is a huge company and it's quoted on the Kronland Stock Exchange, and because of that they prepare their financial statements in accordance with international financial reporting standards. Furthermore, we're told that this particular stock exchange is very active and very well regulated. So any company with its shares issued on this particular stock exchange needs to adhere to these rigorous, onerous regulations, and there will be reputational benefits that come with being listed on such a well-regulated exchange. The perception is likely to be that a company like Novak really has its house in order if it has a listing on this stock exchange. So there's also a very comprehensive code of corporate governance that comes along with being listed on this particular stock exchange. And we'll talk about corporate governance and best practices related to corporate governance when we look at the organizational structure of the business and talk about some of the key members on the board of Novak. So there we go, that's the introductory section of this pre-scene document. And now we need to discuss the implications of this information. First of all, discussing the senior management role. It's clear that you have risen up through the ranks. You'll remember from your operational case study, for example, you started out as a lowly finance officer, where you were just advising perhaps your direct line manager. And then in the management case study, you had a bit more authority and you had a managerial position yourself. And it was all about looking at the mid-term rather than the short term and monitoring the implementation of strategies set out at the high levels of the business. But with the strategic case study, you yourself are in place at the top of the business, and you're discussing strategic issues, so you have a long-term focus and you're discussing those issues with the most senior people at the company, i.e. the board. You're likely to be interacting with the key executive directors of the company, the chief financial officer, the chief executive officer, etc. And you're also likely to be discussing issues with a wide range of skill sets, etc. So you're not just going to be interacting with finance colleagues, you might well be interacting with HR colleagues, marketing colleagues, etc. So you really need to bear in mind the knowledge of the people you are interacting with. You can't assume that they have intimate knowledge of financial statements, etc. So you would be expected to keep that in mind and to unpack some of the terms that you discuss if they're particularly technical in nature. Your people and leadership skills are more important at the strategic level. You remember that CIMA tests 4 competencies in its case study exams: technical skills, business skills, people skills and leadership skills. At the operational case study, the technical skills are more heavily weighted. They account for about 64% of the total marks in that exam. But at the strategic level, there's actually an even split across the 4 competencies. Each skill set is allocated 25% of the total marks, with people and leadership skills becoming much more important. That's because you're expected to influence the senior leaders that you are conferring with. So therefore, your people skills are definitely going to be more important, and you're expected to guide the company and actually help in formulating the strategy yourself. So you're expected to understand the full context in which the business operates, understand its competitive environment, for example, understand the wider regulatory environment, which will be very important for the pharmaceutical industry, as we will see. And all of that is meant to inform your decision making and the advice you give in relation to the long-term strategy of the business. So thinking of the big areas from your objective studies that would be touched upon in the strategic exam. E3, it's all about recommending the right strategic options. P3, it's about assessing and treating the risks associated with some of those strategic options. And F3 studies, thinking of those, it's all about getting the right long-term funding in place and ensuring your financial strategy is the right one for your company as it relates to your dividend policy, your investment policy, financing policy, etc. A quick word then on the currency here, the C dollar. We would immediately ask whether Novak is a company that is engaged in cross-border transactions or whether it's limited to its own home market. This is a huge company and one that is operating globally. So the currency is obviously going to be a factor, given the fact that they'll be selling in other markets and likely will be exposed to movements in different currencies. So it's worth asking whether they have any strategies in place to deal with adverse exchange rate movements that it could affect the financial performance of the business, for example. And we will see when we look at the financial statements later that there doesn't seem to be any hedging strategy in place, so they're rather exposed to exchange rate risk, which you would have touched upon in your F3 studies. On the next page then, we look at the industry background, and it certainly is a fascinating industry. So we're told that pharmaceutical companies develop and manufacture pharmaceutical drugs, and the point of developing and manufacturing these drugs is to prevent, cure, or treat diseases. More than 5 million people are employed worldwide in this industry, and we're talking here about global companies with global sales, and those global sales, when you aggregate them across all companies, come to $1,100 billion every year. So it's a massive industry. And when we're talking about pharmaceutical companies, we exclude a number of related areas such as veterinary medicines, health-related products, other than prescription medicines. When we talk about prescription medicines, which is what pharmaceutical companies are manufacturing, we're talking about a list of medicines that are prescribed by qualified medical professionals. They use an approved list of medicines. That approved list is put together by the regulatory bodies that control the entry of medicines into the marketplace. They vary from country to country, but later on we're told that these regulatory bodies often have very similar rules across different countries. Some pharmaceutical companies, however, are actually involved in non-pharmaceutical activities such as over-the-counter drugs. They don't require a prescription, for example, and other health-related products. So, thinking about this introductory paragraph to the industry, first of all, by far the most important part of what these companies do lies in the development stage rather than the manufacturing phase. We'll see that most of their efforts and most of their expenses seem to be wrapped up in the research and development stage, and that stage can actually endure for many, many years before they actually hit on a winning formula for the drugs that they offer. This is obviously a massive industry. Just to put it in context, the pharmaceutical industry places, according to different sources, in the top 5 to top 10 industries in the world. So it is absolutely enormous. And as we see, it's a massive employer as well. The stakes, of course, they really couldn't be higher. We're not talking about, the sale of fizzy drinks or something like that. There is nothing superfluous about what the pharmaceutical companies sell. The products that they sell literally save lives. They're the difference between life and death, and the stakes could not really be higher. Regarding then Novak, we'll see later that their revenues account for about 6% of the total global sales that have been identified here. So, as I said, Novak is a massive company, and even a relatively small slice of this $1,100 billion in sales every year is a massive, massive chunk of change. We're told in the next paragraph that there is no single company that accounts for more than 10% of the global market. Furthermore, these companies are all operating globally. They have factories and research centers placed strategically because having a local presence can actually affect the extent to which drugs are licensed and prescribed. So it's very, very important to have a local presence and to maintain close ties with government regulators who have a huge impact on this marketplace. The different regulatory agencies have the final word in the drugs that can be deemed to be safe and cost effective, and which drugs would make the final approved list from which doctors can choose when they're treating their patients. So they're powerful gatekeepers in the market, government regulators. The fact that these companies are all operating across many different countries means that they're geographically diversified, so they're not reliant on any one market. And this reminds us of themes relating to globalization, which you would have come across in your enterprise pillar studies, coming across it at an early stage, even in your E1 studies. Remember that globalization discusses the interdependence of countries, the increased trade that we've seen over the last 30, 40 years between countries, and the increase in capital flows, and the rapid diffusion of technology across different markets. Now, the forces of globalization have been perhaps under attack over the last 5 years or so, with big geopolitical movements such as Brexit, for example, threatening the degree to which countries trade, and we've seen a lot of hostile talk in terms to protecting national interests as opposed to being more globally, than countries being more globally integrated. Even Donald Trump in the United States has talked about, putting America first, whereas before, over the last 30 or so years leading up to Trump and Brexit, it was all about promoting international trade. Looking at this graph then that we're presented with of the big pharmaceutical companies and their revenues and market shares, we see that there are about precisely 16 companies that dominate this entire market. What we have here is a kind of an oligopoly. We have a group of huge companies. There are likely to be very, very high entry barriers into this industry. Not just anyone can set up a pharmaceutical company, given the huge research and intellectual know-how that goes into making and researching these products, the huge expenses that come along with this research. It's likely that these firms are actually price setters rather than being price takers. So the marketplace is not really determining the price that they have to set. There aren't as many competitive forces, etc. We'll see, especially soon, the impact that patents have, for example. They confer monopolistic rights to a company that wins the right to a patent, for example, for a particular drug, and that gives them huge power in terms of the prices they're able to set. 16 firms overall dominating the entire market, so it's relatively few firms in this marketplace, and they're likely to be keeping a very close eye on the moves that each of their competitors makes. It's unlikely that any one competitor would want to rock the boat too much. Each company enjoys pretty much a good thing. They don't want to upset things too much, and they don't want to certainly incite a price war, for example. With an oligopoly, firms are likely to copy moves made by their competitors. So if there is a small price shift from one competitor, it's very easily seen by the rest of the pack, and they can follow suit easily. This is why competitors are not likely to be too bold in making price changes, etc., because they know they'll just be copied anyway. So we have Novak placing as the 7th largest company here according to market share and revenues. And interestingly, we'll see that a number of these firms are not just present in pharmaceuticals. Remember, these are the prescription drugs that need to be prescribed by medical professionals, but they're present in other healthcare areas. So those would be over-the-counter drugs, ones that don't require a prescription, and other areas in relation to health. And that can give certain companies a big advantage in terms of its revenues. So, for example, if you take a look at Trend, for example, most of their revenues seem to be coming from the other healthcare areas, and actually pushes their overall revenues above a company like Novak, which is a much larger influence in the area of pharmaceuticals. So the companies that are actually operating in other healthcare areas, they are more diversified firms. So we talked about the geographical diversification, not being reliant on one market, and a number of these firms are also even more diversified due to having an offering in the other healthcare segments. So certainly it's something for Novak to consider at this early stage. Do they want to ramp up their revenues by going into the other healthcare category? Before we move on, I thought this was an interesting extract from a recent Financial Times article on the pharmaceutical industry, and it touches upon a couple of the points I've been making about the oligopolistic nature of this particular market. And they go even a step further and refer to the monopolistic considerations that come along with this industry. And the quote runs as follows: "In all industries, monopolies and oligopolies limit choice and extract economic rent. In medicine, they do so when consumers are most vulnerable, often frightened, unable to forgo the product altogether, and dependent on experts in making decisions." And that one extract from the Financial Times, I want you to keep it in mind as we work through this pre-scene. It's very telling, and it kind of sums up some of the difficulties inherent in this industry. Given the fact that there are such high barriers to entry, given the huge costs in setting up a pharmaceutical company, given all of the regulatory checks and requirements, etc., and the regulatory hoops these companies need to jump through in order to get one drug to market, given the huge costs that they incur in researching these drugs and the necessity to price the few products that actually do make it to market at such a high level that they're able to absorb all of the costs that they have incurred on the products that never actually go to market, all of that makes often the drugs that they offer to the end user really very expensive. And because we're talking about issues of life and death, this is an industry that often generates a lot of controversy. There have been lots of stories in the news recently about pharmaceutical companies abusing their monopolistic positions when they have, for example, a patent right to, as the sole provider of a single drug. They can do what they want with the prices there. So lots of ethical issues come to the fore with this, with consideration of this particular paragraph, and I want you to keep it in mind as we move through the pre-scene. Okay, research and development, an absolutely key phase and part of what the pharmaceutical companies do. Research and intellectual property are absolutely critical success factors for pharmaceutical companies. We're told that the trend in sales and operating profits for these companies are driven by success or failure in launching new products and in maintaining the market position of existing products. So, launching new drugs is very much dependent, first of all, on the safety of those drugs. So companies need to test these again and again and again. And we'll see the different testing phases when we look at the diagram below. But not only that, they need to meet the approval of regulators. And we'll see soon that there are two regulatory bodies that have a huge impact on which drugs can actually make it to market or not in Cronland. And that's actually pretty reflective of the real life scenario across different countries. One regulatory body looks at the safety and efficacy of the drugs that are being proposed, and another regulatory body looks at the cost of buying these drugs. And the people who are buying these drugs are not actually the patient, really. It's insurance companies, it's health services, and doctors are also having a say in which drugs should be bought in treating their patients too. When it comes to maintaining market position, once a company actually does make it to market, there are challenges that they need to meet there as well. Because the amount of time they can actually extract revenues from a particular drug is very dependent on the length of the patent that they have. And we'll talk about that in detail in a couple of pages' time. Also, especially when it comes to off-patent drugs, when the patent runs out, they no longer have a patent to protect their right to be the sole producer of a drug. A number of companies can then actually produce off-patent drugs. So a lot depends on competitive forces there. And a lot will depend as well on the brand power for particular drugs and trademarks that certain companies would have erected for particular drugs. They can have a big influence on the endurance of the different products that they have in the marketplace. So interestingly, we're told that the pharmaceutical companies actually make most of their profits from a few key products. But leads can be lost very easily if competitors develop superior products. So this ties in with the Pareto principle, otherwise known as the 80-20 rule. So Pareto was an Italian economist, and he noted that for many events, roughly 80% of the effects come from 20% of the causes. And in this case, we're talking about maybe 20% of the products that a company works on secure about 80% of the revenues. Now, the weighting can be a little bit different. In fact, in this case, I would probably estimate that it would be 5 to 10% of the products actually generate 90 to 95% of the profits and revenues for a company. Developing and testing then is costly and time consuming. So we're talking about huge sunk costs that go into these drugs. And innovation is going to be absolutely key to stay ahead of competitors. There's always the threat that a competitor can come in and develop a superior product. So let's take a look at the different stages of the research and development process. There is a research and preclinical testing. This is where the drug is discovered and tested, and it can typically be expensive, as are almost all steps in this process, except the last one relating to the regulatory review. This takes years, and straight away, right at the start, we have a bottleneck. Testing on healthy volunteers is the next stage then to determine side effects, also very expensive, can cost millions of $. It takes months, but I would ask the question at this early stage as to whether this is actually ethical. We'll be discussing this phase in more detail later on. There's an article later in the pre-scene which shows a number of volunteers, healthy volunteers, and a particular pharmaceutical company is testing a new product on them, and they fall very ill. The next stage then is if it passes that stage and side effects are determined to be not serious, you can move on to testing on a small sample of patients. That takes about a year, very expensive as well. The next stage is the most expensive, costs hundreds of millions of dollars, and that is testing again, but on a much larger group of people. That takes roughly 2 years, another bottleneck here. And the final stage then relates to a regulatory review, which also takes about a year. It's not very expensive. It varies country to country. And this is where the two regulatory bodies I talked about earlier, one looking at the safety and efficacy of a drug, the other looking at the cost to the insurance companies or the health service in the country. This is the final stage before launch. So, we're told that in-house corporate research facilities is one way of going at the research stage, or there can be funding provided to university departments. In this way, a company can turn a fixed cost into a variable cost. If they don't have enough manpower to research a particular drug, they can go to a university department and try to get that team, draw on the expertise of that department. So the initial study phase takes place in a laboratory. There is testing of the effects of chemical compounds and samples of human tissue or on animals, and there is knowledge of these chemical properties, and the use of computer models has become very, very important in recent times, because with computer models you can skip out a lot of the trial and error, and computer models can actually predict the interaction of different chemical compounds on diseased cells. And anything really that can speed up the research and development phase is very, very welcome. And the use of artificial intelligence is likely to impact this industry quite profoundly in the coming years and decades. And look at this, 90% of all projects are abandoned during research and testing. So that means 10% make it through. And of those 10%, how many actually make it through the regulatory reviews, for example? Altogether, the companies involved in this industry are incurring a lot of cost, high sunk costs, as I said, a lot of risk in pursuit of high rewards. Obviously, the 10% or the 5% of products that actually make it through and can be sold to the final consumer are sufficiently profitable to cover all of these high sunk costs. A key for these companies is going to be the identification as quickly as possible of the products that are likely to fail, so they can abandon them quickly and they can stop incurring costs that will not have any kind of return. So a big part of obviously the research and development phase is trying to ascertain whether these drugs are, if they're efficient and do what they are designed to do, but also whether they're safe. And safety, we're told, is a relative term because many pharmaceutical products have side effects and can actually make the patient feel unwell. But the key is to perform a kind of a cost-benefit analysis to ensure that the benefits of the drug outweigh the costs of the drug. But we're talking here really about imperfect solutions. And in the pharmaceutical industry, there seems to be a constant cost-benefit analysis going on the part of pharmaceutical companies, on the part of regulatory bodies as well. Going on then with this theme of side effects, one of the functions of testing is to know the side effects and to manage them. So you can manage the threat then in that way. As we said before, you can live perhaps with certain side effects and even severe side effects if the benefits that they confer to the patient exceed the costs. So drugs that threaten severe side effects may be authorized for sale if they can treat a very serious illness. So an imperfect solution, but better than nothing. And there is always the threat, even after drugs have launched, that there will be some issue that leads regulators to pull the drug from the market. So there's the threat of unforeseen side effects shaking confidence in the drug, and the drug might be pulled from the marketplace. So we're told then of the different stages of the testing phase. The first set of tests involves giving the drugs to healthy volunteers who are generally paid to participate. And the idea here is to identify the side effects. Now, immediately we can start talking about the ethical repercussions of this step. You're testing on human candidates. They volunteer. We'll see later on that they actually sign a waiver form. It means that the pharmaceutical companies are not held as responsible should anything actually go wrong. And things do go wrong, as we will see in an article later in the pre-scene. If this step is successfully navigated and there are no dangerous side effects, we're told then the drug can progress to clinical trials. And the first step in the clinical trials is to take a small number of patients and see how that goes. And then you can progress to a large-scale study to check on the safety and effectiveness of the drug. Obviously, with the larger sample, you get a more accurate more accurate feedback, and you get a better understanding as to how safe and effective the drug actually is. And we have a very interesting point here about the placebo effect, which you may have heard of before. The placebo effect is very interesting. It discusses the extent to which participants could potentially fool themselves into thinking that whatever they're taking, whether it's the dummy version of a drug and doesn't contain anything, or a test drug, for example, is having a beneficial impact, when in fact it is having no such impact at all. So the mind can be a very, very powerful thing indeed. But the idea is with a large sample size, you can overcome these biases. And also there is the need to provide a dummy version of the test medication. So the dummy version goes to what is called the control group. And there is another group that gets the real thing. And in that way, then you can compare the effects on one group to the effects on the other group. And hopefully the pharmaceutical company then can ascertain the real effects of their test drug on each group. So self-reported effects can be very unreliable, so this is why it's very important to have a large sample size, and it's why it's necessary to have this very, very expensive step in bringing a drug to market. So overall, it can cost billions of dollars to actually bring a new drug to market. So these companies are really betting the company on a few blockbuster drugs, on the 5% or so of drugs perhaps that get through, that pass through all of these testing stages and pass the final regulatory steps. So they need a few big hits to overcome the huge expenses that they're incurring at these early testing stages.